I'm Belinda. I'm the clinical nurse facilitator for Tanunda War Memorial Hospital in the Barossa Valley. It is one of the small regional hospitals in the Barossa that look after our community. My background coming from Sydney actually in a metro hospital, so I was a very good nurse in my own right. And I suddenly realised that I really didn't know very much. As a nurse, I was very specialised in the care that I did provide. When you work in regional or rural placements, you get to look after everything that comes through metro, just in a smaller space. It is everything from paediatric, acute patients, farm accidents, palliative care patients.
Sometimes you get some major emergencies out here and we're it, you know. There's no real backup there straight away. Because you're it, you're developing a lot more new skills. It can be exhilarating sometimes. You learn not to allow it to stress you out. You keep calm and work as a team, and I think we do a really good job.
My name is Samanpreet Kaur. I'm studying Bachelor of Nursing with Torrens, and I'm doing my rural placements. When I was about to start my placements, I was thinking, oh, probably they won't have that much sources or anything, but this is equipped with everything. The help is there, the doctors are always available, everything is done right away. So my perception of rural has been changed while coming here. The patient load is less, so we kind of focusing on more things. It gives you more support and more learning experience, and it's a great opportunity to work on your own. And also, if you're looking for support, the right support is there. As a student, we are learning to do IV antibiotics, IV cannulization. We have learned blood transfusion, also how to do the triage when someone comes in emergency department. So that was totally new experience as a student. We are not in a rush, so get to spend more time learning about one patient.
What I find the best is the way I'm actually able to interact with my patients. It's patient focused, not task focused like it is in the metropolitan. By getting to know them, I feel I'm giving better care to them.
Barossa Valley. It is a beautiful community, a lot of community focus, family friendly. It is a great place to work because you are community based and you do look after people that appreciate the care that they receive in this space.
I would always prefer working in rural rather than going to city. Like, the drive to this place is so beautiful, the scene is so good, like you enjoy the drive. I don't have to see any traffic light while I'm coming here.
It is not that far from Adelaide. You don't have to pay for parking.
I would say grab the opportunity. Rural nursing is challenging but rewarding as well. You will get a lot to learn, and I think it's an exciting opportunity.
Rural nursing is challenging, rewarding,
and a fantastic way to grow as a nurse.
Step out of your comfort zone. Your future patient needs you.